Hi, I'm Patrick Hayes, orthopedic surgeon who operates at Cleveland Regional Medical Center. I'm fellowship trained in shoulder surgery, did a lot of my extra training at Mount Sinai in New York, and did my residency in orthopedics at Chapel Hill. Today I want to tell you about some of the new things we're doing with respect to shoulder replacement in the patient who has a massive cuff tear. Now, prior to 2004 in the United States, we didn't really have a great solution for people with massive rotator cuff tears. There are things we tried, partial replacements and special shoulder replacements for people with massive cuff tears to take away pain, but the person with a massive rotator cuff tear just can't lift their arm up to take care of themselves. In 2004, a prosthesis that had been developed in Europe in the late 80s called the reverse total shoulder replacement, and I'll explain to you what that is in just a second, came to the United States after FDA approval. And we now have the ability to do that type of operation. Initially, that operation was for people in their 70s or 80s who had failed other operations and just couldn't lift up their arm, and their cuff was too far gone to fix back. But now the indications for that operation have expanded to the younger patient in the 60s and people with bad fractures as well. The reverse total shoulder replacement is called reverse because in the regular shoulder, the ball of the ball and socket joint is on the arm bone side, and the cup of the ball and socket joint is on the shoulder blade side. When we do a reverse replacement, we actually reverse that. We take the ball, a metal ball, and screw it into the shoulder blade side, and we put a plastic cup fixed to a metal stem on the arm side. The reason why we do that is in people with massive rotator cuff tears, where all these muscles are pulled off the upper arm bone, and basically if you were to open the patient's skin and deltoid, you'd be staring at a head with no muscle attachments around it. That's a person who can't lift up their arm. And the reason why they can't lift up their arm is the rotator cuff tendons are supposed to pull the head into the cup and hold it steady and stable like that. When you don't have that rotator cuff pulling the head into the cup, the head slips out of the cup and now is unstable, and now the deltoid muscle can't lift the arm up. If the rotator cuff tear is too far gone to fix all these back, in the past your options were live with it or have a replacement to take away the pain, but you still couldn't raise the arm up. Now we can change the mechanics such that the ball is screwed to the cup, and you don't need the cuff to pull that cup into the shoulder blade anymore because it's screwed in place. With the cup then on the arm side, the only muscle you need to work to raise that arm up is the deltoid. So one of the requirements of the reverse total shoulder replacement is the deltoid has to work. But given that, we can now help a lot of people who in the past have been told, I'm sorry, there's nothing we can do for you. So it's a great operation for people in this select group with a rotator cuff tear that's been previously repaired and it has failed, or people who have had such massive tears that they just can't be fixed. This is an operation that can reliably take away pain, reliably restore elevation above the horizon so that older folks can get to their mouth, the top of their head, even the back of their head, reach into the shelf over eye level. And it's a great way to help preserve function and preserve independence in that situation. And here's what the metal components look like. Here's the ball that screws into the shoulder blade side. Here's the stem that goes down the upper arm bone with the plastic cup on it. This is a stem that is designed to be cemented in place. I am now, with several other surgeons in the country, doing this type of operation without cement. The advantage to that is the operative time is considerably less. In fact, I can now do this type of shoulder replacement in about an hour and 10 minutes. So that helps reduce your chance of infection. The other advantage is, heaven forbid, if something else happens after surgery, rarely, about 1% of the time, you can get a postoperative infection, then we can take this system out without destroying all the bone that this style stem would be cemented into. I have, unfortunately, in the past had to take out a cemented stem, and that created quite a bit of destruction of the upper arm bone. I have since, only one time, had to take out one of these stems that wasn't cemented in place, and it went like a dream. The operation took about 25 minutes. We cleaned out her infection. We were able to primarily replace the shoulder right back, and she's doing great. And she didn't lose any of the upper arm bone. So working with Tournier as a consultant and several other surgeons around the country, we've developed this technique where we can now do this operation press fit, and we're doing it right here at Cleveland Regional Medical Center. I think it's a great boon to my patients. I do more of these operations than about anyone in the region except for the big cities, Charlotte, Nashville. Some surgeons there doing about the same number as I am, some a few more. But we have great experience. We got a great team. We can do a well-made operation for you right here at Cleveland Regional.